A 35-year-old male undergoes an allogeneic hematopoietic stem cell transplant for the treatment of acute myeloid leukemia. 3 weeks post-transplant, he presents with a widespread maculopapular rash, diarrhea, and elevated liver enzymes. A biopsy of the affected skin reveals lymphocytic infiltration. What is the most likely mechanism underlying this patient's condition? A. Donor B cells attacking host tissues. B. Host immune cells rejecting the donor graft. C. Donor T cells recognizing host HLA antigens. D. Autoimmune reaction triggered by the transplant. E. Cytokine release syndrome. Before going forward, please pause and write your answer in the comments. Now let's find out the correct answer. Answer: C. Donor T cells recognizing host HLA antigens. Explanation: this patient is experiencing graft-versus-host disease, GVHD, a condition that occurs when donor T cells recognize the host's major and minor HLA antigens as foreign and initiate a cell-mediated immune response against the host tissues. The organs typically affected in GVHD include the skin, intestine, and liver, which aligns with this patient's presentation of rash, diarrhea, and elevated liver enzymes. The other options do not describe the mechanism of GVHD. Option A: donor B cells are not primarily responsible for GVHD. Option B: host immune rejection of the graft describes graft rejection, not GVHD. Option D: autoimmune reactions are not related to the allogeneic transplant context. Option E: cytokine release syndrome is a different immune-mediated condition often associated with CAR-T cell therapy. Key takeaway: GVHD is a serious complication of allogeneic transplants, where donor T cells recognize and attack host tissues. Recognizing the clinical manifestations and understanding the underlying mechanism are crucial for diagnosis and management. If you loved this video, please like and hit the subscribe button. We will keep uploading new questions on a regular basis.